Hi, I'm Belle. I'm from Chicago. I'm a 58-year-old endurance athlete, and as I age, I'm finding my knees are about my only problem in my body. I'm very healthy, and I do endurance sports, primarily triathlon, Ironman events, swim, bike, run, and my knees are not allowing me to continue in my sport right now. So I've been going to a doctor in Chicago that was giving me a procedure of cortisone and Synvisc in the knee, and it wasn't working for me. I still had knee pain, I still had osteoarthritis pain, and I just didn't feel like I could run the distance I needed to in my event. I came to Dr. Dave as a recommendation from my coach who's a pro triathlete. I never would have gone this route. I was going the osteopath. I was going to doctors at Northwestern and for the cortisone and the Synvisc, and I never thought about the regenerative route. But when I found out he was a 18-time Ironman, I knew he would know me, and he would know that I'm not trying to just get through my day. I want to compete just like he does. So I can't tell you how much he helped me. Just in talking to him and knowing that I trusted him. It was everything to me to be able to trust him. So our relationship has really grown from that. I came to Dr. Dave with an MRI from my previous doctor, and he saw how corrupt both knees were. And from there, he suggested that we go with the tissue rejuvenation. And so when I got the shot this past March, in just the one knee, it was immediately better. The pain, the pain relief was immediate. Although I wasn't able to, run, I could swim and I could bike after a couple weeks, but I couldn't run yet. So Dr. Dave followed up with me 2 weeks, after the procedure, and increased my activity level at that point. And from there, I would check in with him every 2 weeks, and we'd increase my activity level until I was eventually able to run. And I've done an Ironman and several smaller races, a half Ironman, a full Ironman, several other triathlons. And this last Ironman I did in October was brutal. And because of the shots, I was able to get through it. So, it was, when you bike 2.4 miles and you swim, or you swim 2.4 miles and you bike 112 and then you have to run 26, you've got to have good knees. So I was able to get through it. I have Blue Cross Blue Shield, and it's a PPO policy, and it's a great policy, and they're completely paying for, they paid for both shots, the amnio and the Palagen, and that afforded me the ability to do it. I'm not quite sure I could do the full stem cell. Financially, it's a lot more. Although if this doesn't work, I probably will go to the stem cell, my own stem cell. But so far, this is working, and because of the insurance is paying for it, this is what's working for me right now. I'm not trying to just get through my day or do, just normal activity. I'm trying to do, an Ironman. I'm not trying to do just a simple triathlon. I want to be able to compete, So I'm not just after getting rid of the arthritis. I want to swim, bike, run, and I want to compete, and I want to do it at a high level. And that's why I came to Dr. Dave. Changed my life.
It was excellent treating Belle. Came to us a little less than a year ago, and she is a high-level endurance athlete, does Ironman triathlons. Came to us last winter at some point in time. After having been evaluated at other institutions, she was suffering from some arthritic conditions in her knee that was keeping her from exercising like she wanted to. She's very passionate about Ironman, triathlon, running, and staying physically fit. Because of the injury, both not only some arthritic condition, but some meniscus issues that she had going on was preventing her from doing what she was passionate about. And it's just very rewarding to treat patients such as Belle. I myself still currently do Ironman, triathlons, as well as other endurance events, marathons. And so I certainly can relate to her and know what that feels like when there's an injury that is keeping you from doing what you love, what you're passionate about. And so it was just a real joy to meet her and the passion that she has for exercise. Now for Belle, with her knee, she had previously had arthroscopic surgery, had steroid injections, and all the traditional care that you come to expect. Our practice is focused on newer treatment modalities from the regenerative medicine realm, and that is a newer field of medicine that is proving very safe and effective, and we're seeing success that far outlast people that are receiving these other type of treatments. For her specifically, we treated with a tissue-based regenerative product that allows a pathway of repair and regeneration to occur. That initial injection in many patients is going to be successful on that first treatment. Given Belle's extensive exercise background and training for an Ironman, it was successful enough to get her through the summer, and even more so to be able to treat her in a non-surgical fashion. We treated her and were able to successfully get her to the point where she trained this summer at a high level, again, training for an Ironman triathlon. And she was able to successfully complete Ironman Louisville this fall. And it was interesting. I was actually participating in that event myself, and we were at the expo and crossed paths, and was a great time seeing her there and knowing that she was up to undertake this event after treatment, was able to get that training in. She was just great to deal with throughout, and looking forward to helping her if and when anything else comes up in the future.